Ibanessa and I are presenting our research on a feasibility study of using wearable devices for remote cardiometabolic health monitoring in a global health scenario. This research project was funded by the Community for Global Health Equity and the University Honors College. From December 2017 to January 2018, we traveled to Kerala, India to conduct our research. Kerala is known as God's own country. In the next few slides, you'll know why it's given this name.
This beautiful site is the backwaters in Valakal village, a common passage for the village fishermen. And this magnificent view is captured from the mountains of district of Wayanad. This vibrant beach is known as Varkala Beach, a very popular tourist destination. Our residence was near Amrita Ashram, a very famous monastery of Amma who is an influential and humanitarian spiritual leader and Amrita University's chancellor.
Our project was part of the Live in Labs program hosted by Amrita University. This paragraph that is taken directly from the university's website highlights the mission of this program, which is to expose youth to problems faced by rural communities in India. Our project took place within the Wireless Networks and Applications Department and the Center for Research in Advanced Technologies for Education. Below is a picture with our teammates at Amrita University's Engineering College. With an increase in prevalence of cardiovascular disease and diabetes worldwide, and disparities in access to healthcare in rural populations, remote health monitoring can offer a possible solution. For this purpose, a wearable EKG and a non-invasive blood glucose monitor have been developed by the WNA department at Amrita University to bridge the gap between patients in rural areas and providers. Many challenges exist in providing healthcare to rural populations, some of which include burden of cost and time of transportation, limited healthcare institutions and personnel, poverty, illiteracy, and unemployment, that despite having a large rural population, all contribute to inadequate healthcare in rural areas. These pictures are taken from a tribal community in the district of Wayanad.
Over the term of our stay in India, we carried out the deployment phase of the two devices, previously introduced in multiple healthcare settings to assess the feasibility of integrating them into the healthcare system and to identify the proper steps to increase their acceptance among patients and healthcare personnel. The main parts of the deployment phase took part in the districts of Wayanad, located in the northern part of Kerala. Different tribal communities reside in scattered parts of this district and most are disadvantaged in access to healthcare. Some have to travel as long as an hour to get to the nearest healthcare facility. With a large portion of this population consisting of daily workers, this has a significant economic toll on the residents. Volunteer physicians at Amrita Kripa Charitable Hospital have devoted their careers to provide care to the rural population. This hospital, that is staffed by a couple physicians and multiple nurses and lab technicians, is the main point of access to health care to many tribes all over the district. The staff also set up camps in different places that provide care to different tribal communities in designated days of the week.
We collected data on our devices from patients who presented with cardiovascular diseases or diabetes and were ordered by the physicians for an EKG or blood glucose monitoring. We interviewed patients, physicians, and community health workers to understand how our wireless devices can be integrated into the healthcare system to improve access to healthcare in rural populations by connecting physicians and their patients. We conducted analysis to compare our results to 12-lead EKG and invasive blood glucose readings.
We learned from our analysis and interviews that wearable health monitoring devices can improve health outcomes in areas with reduced access to healthcare if appropriate educational and outreach efforts are made by community-trusted individuals or organizations. Future directions include community outreach efforts, education, and health literacy initiatives to increase acceptability of wireless health monitoring devices in rural populations.